welcome back to the channel. Today we're diving into a critical topic that affects many patients worldwide, the most dangerous traction operations. Traction, as many of you know, is a powerful tool we use in orthopedics to help realign bones, reduce fractures, and manage spinal conditions. But with great power comes great responsibility, right? It's not without risks. We're going to take a closer look at the top 10 most dangerous traction operations, exploring the reasons behind their risks and the potential complications. Now, this isn't meant to scare you, but knowledge is power. Understanding these risks is crucial for both patients and healthcare providers to make informed decisions. First up is cervical traction, used for neck pain, herniated discs, and spinal stenosis. It involves using a gentle pulling force to stretch the neck and create space. Sounds simple enough, right? But here's the thing. The cervical spine houses your spinal cord, a superhighway of nerves that control everything from your arms and legs to your breathing. Any excessive force or improper technique during cervical traction can have devastating consequences, leading to nerve damage, paralysis, or even stroke. It's incredibly important to have a skilled professional administering and monitoring this type of traction. Next, we're moving down to the lower back with lumbar traction. It's often used to treat lower back pain, sciatica, and degenerative disc disease. Now, the lumbar spine is a bit more robust than the cervical spine, but it's still a delicate area. The big risk here is nerve damage. Improper traction can pinch or compress the nerves that run through your lower back and legs, leading to pain, numbness, tingling, and even weakness. Now let's talk about skeletal traction. This type of traction involves surgically inserting pins or wires directly into the bone. It's often used for severe fractures or when a lot of force is needed for realignment, while effective skeletal traction comes with a higher risk of infection. Think about it. You're essentially creating a direct pathway for bacteria to enter the body. Plus, the pins and wires themselves can become infected if not cared for properly. Moving on to pelvic traction, which, as the name suggests, is used to stabilize the pelvis after a fracture or surgery. It involves applying a pulling force to the pelvis, typically through a harness or belt. One of the most serious risks associated with pelvic traction is the development of blood clots, particularly deep vein thrombosis, or DVT. When you're immobile for extended periods, blood flow slows down, increasing the risk of clots forming in the legs. These clots can break free and travel to the lungs, causing a pulmonary embolism, a life-threatening condition. Now let's discuss halo traction, one of the most visually striking forms of traction. It's used to immobilize the head and neck, often after a spinal cord injury or complex cervical fracture. A halo-like device is attached to the skull with pins, and weights are used to provide traction. While effective, halo traction comes with the risk of pin site infections, a constant concern. Plus, there's a chance of bone fractures if the pins loosen or the traction is applied incorrectly. Next, we have skin traction, a less invasive option that uses straps, bandages, or adhesive materials applied to the skin. While it's generally considered safer than skeletal traction, skin traction has its own set of risks. One of the main concerns is muscle atrophy or muscle wasting. When muscles aren't used regularly, they weaken and shrink. Prolonged skin traction can also lead to skin irritation, blisters, and pressure sores, especially in areas where the traction is applied. Moving on to spinal traction, a broader term that encompasses both cervical and lumbar traction. When we talk about spinal traction in general, one risk that stands out is the potential for respiratory issues, especially in patients with pre-existing conditions like asthma or COPD. The traction itself can make it difficult to breathe deeply, and if the traction is applied incorrectly, it can even restrict chest expansion and reduce lung capacity. Let's talk about buccal traction, a type of skin traction commonly used for hip fractures and femoral shaft fractures. It involves applying a pulling force to the leg with a system of ropes, weights, and pulleys. One of the biggest challenges with buccal traction is preventing skin breakdown. The constant pressure from the traction can damage the skin, especially around bony areas like the heel and ankle. Next up is Russell's traction, another form of skin traction used for lower limb fractures. It involves suspending the leg in a sling and applying traction with a system of ropes and weights. While generally safe, Russell's traction can lead to joint stiffness if the affected limb isn't moved regularly. It's crucial to incorporate range of motion exercises to prevent joint contractures. Finally, we have Dunlop's traction, a type of traction used for fractures of the humerus or upper arm bone in children. It involves suspending the arm with the elbow bent and applying traction with weights. One of the main concerns with Dunlop's traction, as with many forms of traction, is prolonged immobility. Children especially need to move and play for their development. Prolonged immobility can lead to muscle weakness, joint stiffness, and even developmental delays. Thanks for watching. If you found this video informative, don't forget to like, subscribe, and hit the notification bell for more medical insights. Stay healthy and stay informed. Understanding the risks associated with these traction operations is crucial for making informed decisions about your health. Remember, this video is for informational purposes only and should not be considered medical advice. Always consult with your healthcare provider to discuss your specific situation and any concerns you may have.